Every 5 minutes, somebody in the UK suffers from a stroke. Now that could be a friend, a family member, or perhaps even yourself. It's a truly staggering statistic that underscores the urgent need for awareness and understanding of this debilitating condition. Today, we'll delve into the intricacies of strokes, exploring their impact, warning signs, and crucial signs for prevention and treatment.
I'm a consultant stroke physician and I work with 10 of our colleagues at the Royal Stroke Hospital. We are a tertiary neurosciences centre for stroke. We see around 1,500 strokes a year. The key message is that with the advancement in treatment with thrombolysis and thrombectomy and advanced stroke unit care, 40% of our patients walk out of hospital. Prevention is better than cure. And the two causes of stroke are hypertension and an irregular heart rhythm called atrial fibrillation. So a lot of people are not aware that they've got blood pressure because most of the patients having blood pressure have no symptoms. So once you're above the age of 50, I urge everybody to get the blood pressure checked. It's a simple thing and it can probably prevent you from having a stroke. And if you're over the age of 65, whenever there's an opportunity, please check your pulse. If your pulse is irregular, get an ECG done. And if you're in atrial fibrillation, you can get easily treated, and that is a stroke that can be easily prevented. Know your numbers is like all of us know our sort of date of birth. We know all important numbers. We know about the car number plate. Why can't we just know the numbers about what our target should be for our own health? So the Know Your Numbers campaign is to give the numbers to the patient to be responsible for their own health. So the blood pressure target should be around 130 to 120/80. Your good cholesterol should be more than 1. Your bad cholesterol should be less than 2.5. It's called the non-HDL cholesterol. And your diabetes, HbA1c, which is a diabetes control, should be less than 48. So if patients can adhere to these numbers and know that these are the numbers that can prevent them from having a heart disease or stroke, that will be absolutely wonderful. I think a lot of people think that despite the lifestyle, they think medicine is advanced and we can just pop a pill and get these things controlled. Unfortunately, it's not the case. I think the minimum number of pills you take, the better. So in order to prevent you having to take a lot of medications, I would suggest that they go on a healthy diet, mainly salt reduction. Salt is a major cause for blood pressure. Active exercise, brisk walking for 30 minutes. It's not slow walking, brisk walking, and that's why I encourage people to take up park runs or park walks every Saturday in your local near your home, and that will just give you the motivation to walk around. So simple things like that, your diet, your exercise, and make sure that you're conscious of your own health will prevent you coming into hospital and seeing us in the hospital.
A stroke can happen to anyone at any time, and the impact it has on individuals and their families can be profound. Understanding what a stroke is and the journey towards recovery can be crucial in raising awareness and supporting those affected. People just like Peter and Matt.
Hi, my name's Peter and I suffered a major stroke just after my 60th birthday in the summer of 2020. Pre-stroke, I was running my own small publishing company as a social enterprise to collect stories about how people were using sport and outdoor exercise to help them cope with physical or mental disabilities. And I was also working part-time at the local university. And my stroke just came out of the blue, completely unexpectedly. I can't believe with hindsight how I survived it. I was just letting the dogs out for their walk early, like 6 o'clock in the morning early on a Sunday, and just felt giddy, dizzy as I opened the door to let them out, fell out of the door into the garden and couldn't get up, couldn't speak, just didn't understand at all what was happening. And it wasn't until the dogs started barking, because they got agitated, that my wife came down to see what they were worried about and found me clearly just having had a stroke. All the classic symptoms, dropped side of my face, lost mobility on one side, couldn't speak, the full ticket. So, and again, really fortunately, she knew exactly what to do. She rang 999. They came, they fast-tracked me to the Royal Stoke, and I think by 10 o'clock I was in theatre. and I walked out of hospital unaided the next day. That's how lucky I was. It was just it being a clear stroke, the dogs raising the alarm, my wife knowing what to do, coming straight to this unit at the Royal Stroke. So many ifs and buts. If that hadn't all dropped into place, I probably wouldn't be here now. I would have realised that I had an irregular heartbeat, and if I'd been aware of the Know Your Numbers campaign, or if it had been around at the time, then I would have gone straight to my GP, because an irregular heartbeat is a massive, massive risk factor for stroke. And you can be fit and healthy, you can be an Olympic athlete, and if you've got an irregular heartbeat, boy, that's such a big risk factor. Yeah, well, UHM have been fantastic. I mean, in a sense, I missed out on a lot of care, because the initial treatment, intervention of the thrombectomy to remove the clot, which was massive, they brought it to me the next morning to show me, as if I'd want to see it. But they seemed to think I'd be quite impressed that it was like a black slug. I wish I'd kept it, to be honest. What a great thing for dinner parties to bring you a clot out. And yeah, that life-saving intervention to get the clot out before it did hardly any damage at all, that was it. So, you know, I spent 24 hours plus on a ward, just sort of recuperating, physios getting me up and about, and then I was effectively right as rain,
So
out the door.
How grateful are you for that early intervention?
Words can't express it. You know, I belong as a stroke survivor to quite a few stroke groups, and I hear all these heartbreaking stories of people that had a stroke and weren't found for 12 hours and the damage was done, or they didn't have classic stroke symptoms, and it's really hard to identify a stroke sometimes when you haven't got the classic set of symptoms. So again, they didn't get treatment in time, so they've had a lot of damage that has radically affected their life. And I think the worst thing I get is survivor guilt, to be honest, because I see all these people that weren't quite as lucky as me, didn't get straight in to a team as skilled as the team here at the Royal Stoke, and I got off not entirely scot-free, but you know, near enough scot-free that people don't know I've had a stroke. So I still run, I still cycle, I still swim in open water, walk everywhere, I can drive. You know, the stroke probably should have killed me or left me bedbound for the rest of my life. And here I am, thanks to the team here, up and running again. Know your numbers, that's such a good motto. If I'd known I'd had an irregular heartbeat and had it checked out, then I'd have been on the appropriate medication. I might not have had a stroke. I'm right as rain. I'm just one of the really lucky ones.
Hi, my name's Matt. I had a stroke in 2021. I was very energetic. I used to go for a run twice, 3 times a week. General was everything like, and basically I used to drink a lot, eat a lot, just put loads of weight on, and basically that's what I used to be like. I was on a run, I was a bit under the weather when I come back. I went to my mother-in-law's house and just fell asleep, but she's not normally like me. My wife says, "Oh, are you feeling okay?" I says, "Yeah, I feel all right." And then all of a sudden I just fell asleep for a couple of hours. And then I went to the accident centre, and I had all pins and needles in my leg. They didn't know anything about it. And I stayed there, and then this surgeon come to me and he says, "We'll have to put you on a ward and take some tests on you." Anyway, I was there overnight. They did an MRI scan. I came back. I thought, oh, I just had pins and needles in my leg. Next day, they came to me and they said to me, "You've had a stroke." And I'm like, "You what?" I've lost loads of weight. And they were like, "Yeah, you've had a stroke. It's 2 holes in the back of your head. One's emotional and one's tiredness. At the moment, I do feel a bit tired and emotional, but after time you do get over that, and you adapt to your situation that you're actually in. And Indira, the stroke, put me back on my way to where I am now. When you have a stroke, you think your life's ended, to be honest with you. You think, well, what's going to happen? You cry, you think, what am I going to do? You have to believe in yourself to get better. And if you don't believe in yourself, it makes it even harder. But there's a way out there. The hospital helps you 100%. Just believe in what they say, be fine.